there's a lot of hair loss is due to styling options, especially patients that have curly hair. It's a common practice to tie the hair in a ponytail or in braids, and also in the Sikh population is common to wrap the hair in a turban and to create traction, or tightness, prolonged tightness of the hair, by pulling on the hair for a prolonged period of time will eventually lead to permanent hair loss. Nothing is going to regrow hair loss due to traction. That's a condition for which the best treatment is often surgical. And we see this, unfortunately, very commonly in African American women due to styling and tight hair braids and ponytails, and in Sikh men, with the turban use. And also, it's a problem that with thinning, then people look to how can I make my hair look thicker, and they look at extensions or things that they tie into the hair. And if you add something that pulls on the hair, that creates a weight on the hair, if it's prolonged, that can further exacerbate thinning hair. Traction alopecia is sort of easy to diagnose in most cases. It creates a pattern loss, on the sides, on the temple area, this side here, and also in the hairline area. But also, in the case of ponytails, behind the ears, in the back. So it's a very characteristic loss. Of course, we see changes on examination of the scalp. You see certain changes in the hair follicles. The scalp is still fertile in that case. It's not a genetic cause at all. It's all due to the prolonged pulling on the hair, and you can transplant and have success as long as you don't go back to the old styling habits that caused the hair loss in the first place. I encourage people to find an alternative styling method and to embrace the natural. I don't know why, but oftentimes the people with curly hair want straight hair, and the people with straight hair want curls in their hair. So we seem to want what we don't have a lot of times.